Allah يعطيك العافية Dr. Ali, and thank you Dr. Ali for lightening us about the ethical issues and sometimes ethical dilemma in dealing with COVID-19 patient and other issues dealing with that. So maybe we will leave the questions and answer to the end, or between the two, after two sessions. Now we will start with Dr. Himayatullah. He is now with us. Dr. Himayatullah is an assistant professor of medicine. He will speak about the diagnosis and management of acute respiratory failure. Welcome, Dr. Himayatullah.
Thank you. Assalamu alaikum.
Wa alaikum salam.
Thank you. So I should start this screen share first.
What?
Share screen. I will share the screen.
Share. Take your time, Doctor. Okay. Thank you.
Okay. Can you see my screen? Can you hear me?
Yeah. Okay. Go ahead.
Thank you. As Doctor introduced me, I am Dr. Himayatullah, assistant professor of internal medicine, working in Chakra College of Medicine, Chakra University. I will discuss acute respiratory distress syndrome due to COVID-19. It's an important topic because the mortality related to COVID-19 is basically due to the development of ARDS in these patients. But before going into the ARDS, I would like to go through the highlights of COVID-19 in order to build a momentum of the topic and the pace of the topic. After that, we will discuss that which of the patients should be admitted and who should be sent home with precautionary measure and advice. Then who should be admitted in ICU. Then who should be intubated and put on mechanical ventilation. Then we will go through some ventilation strategies who have been proved to improve mortality, hasten the recovery, and shorten hospital stay. In the last, we will discuss what is the last resort if these measures fail, and then some drugs under trial, we will discuss that. So starting with the highlights of COVID-19. COVID-19 stands for coronavirus disease discovered in 2019, and it is caused by a virus which is called as SARS-CoV-2. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. Coronavirus is a large family of RNA viruses. Basically, these viruses cause flu and mild diarrhea in human beings. Quarter of the cases we see around us with flu are basically due to the coronaviruses. But now the question is, why such a benign virus has become so much lethal to the community? So the answer to this question is that this is basically a zoonotic viruses. That is, coronaviruses that are found in animals can mutate and then infect human beings. And these are the viruses that are responsible for the fatal outbreaks. We had examples in past. In 2002, we had an epidemic of SARS infection. The virus mutated in the bats. It transmitted to civets. Civets is a cat-like animal, and then to the humans. It almost affected about 8,000-9,000 of the population, and the mortality was 9.6%. Then we had an epidemic a decade later, which was due to MERS, which is the Middle East Respiratory Syndrome. Again, it is because of coronavirus virus mutated in the bats. It was transmitted to camels, and then it infected the humans. The mortality was 34%, but good news was that it just affected less than 5,000 of patients. Now we are dealing with SARS-CoV-2 infection, which is the virus mutated from bats. It transmitted to pangolins and then to the humans. And till now, the mortality is between 4 and 5%. These are the pictures. This is the civet. Civet is, if you see, it is like a cat-like animal, and it is responsible for epidemic of SARS-1. which was in 2002. And this is the pangolin which is responsible for this epidemic, SARS-CoV-2 epidemic. Something about the transmission, that there are three transmission modes has been discovered. One is from animals to the humans, which we discussed earlier, that it from bat to pangolin and then to the humans. Now it is widespread, and it is due to human-to-human transmission. And third one is human to animal transmission, which has been reported but is not that much effective in animals. In humans, it is spread mostly by aerosol or droplet, but it can be rarely spread through orophycal route. Regarding pathophysiology of pneumonia and acute respiratory distress syndrome in COVID-19, the exact pathophysiologic mechanism is currently unknown, but it can play a role in the two of the mechanisms. One is the direct effect of viral RNA in the host cells, and the other is indirect consequence of host immune response to this viral RNA. Regarding direct effect of viral RNA to the host cells, structure analysis suggests the viruses may be able to bind to angiotensin converting enzyme 2 in the lungs. This virus is then internalized with ACE2, and it takes control of the cellular processes and thus causing the death of the cell. So basically it caused the decreased level of ACE2 as well. So additionally, this ACE2 levels, which has been believed to be a protective enzyme. So studies has shown that both ACE inhibitors and ARBs upregulates ACE2 levels, and its use can be beneficial, but rise in ACE2 levels will increase the binding site for SARS-CoV-2. So the use of these drugs is currently controversial. Regarding indirect consequences of host response, there is immune hyperreactivation due to the viral RNA, and there is the storming of inflammatory mediators. What happens is there is the chemotaxis of inflammatory cells, the interleukins, more specifically interleukin 6, interleukin 1, and tumor necrosis factor alpha. All these interleukins cause increased permeability of the capillaries and endothelium, thereby accumulation of the proteinaceous fluid initially in the space between the alveoli and the capillaries, and then spilling over into the alveoli